Free CNA Practice Test 2026 Ultimate Prep 180 questions with answers. Question 1. Which of the following happens when a patient has a stroke? Option A. The patient urinates themselves. Option B. The patient may foam at the mouth. Option C. The patient may roll their eyes back. Option D. The patient may have drooping of one side of the face. The correct answer is option D. The patient may have drooping of one side of the face. A common and immediate sign of a stroke is hemiplegia, often visible as unilateral facial drooping. Question 2. Which task is correct foot care for a diabetic patient? Option A. Giving the patient a heating pad for his feet. Option B. Soaking his dry feet in a warm tub daily. Option C. Keeping his feet dry and warm with clean socks. Option D. Ensuring his toenails are always clipped short. The correct answer is option C. Keeping his feet dry and warm with clean socks. Diabetic patients often have poor circulation. Keeping feet clean and dry is essential to prevent infections. Question 3. The nurse aide is caring for an 85-year-old woman with a UTI. Which change associated with a UTI in the elderly would the CNA report to the nurse? Option A. Increased thirst. Option B. Sudden confusion. Option C. Low back pain. Option D. Darker urine. The correct answer is option B. Sudden confusion. In the elderly, classic symptoms of infection are often absent. Sudden onset of confusion is a frequent indicator of a UTI. Question 4. You are assisting a diabetic patient with eating and he only finished 25% of his meal. What should you do? Option A. Report this to the nurse in charge. Option B. Nothing, the patient may not be hungry. Option C. Tell the patient they must eat more. Option D. Chart the patient ate 25% of the meal. The correct answer is option A. Report this to the nurse in charge. Diabetic patients require consistent carbohydrate intake to balance insulin. Low food intake must be reported. Question 5. The CNA was unable to empty a urinary bag until the end of a 12-hour shift. Which amount emptied should be reported immediately? Option A. 1000 ml. Option B. 600 ml. Option C. 2100 ml. Option D. 350 ml. The correct answer is option D. 350 ml. Normal urine output should be at least 30 ml per hour. Over 12 hours, 350 ml is significantly low. Question 6. Which of the following represents the correct size for a blood pressure cuff? Option A. Width is approximately 95% of arm circumference. Option B. Width is approximately 25% of arm circumference. Option C. Width is approximately 40% of arm circumference. Option D. Width is approximately 10% of arm circumference. The correct answer is option C. Width is approximately 40% of arm circumference. For an accurate reading, the blood pressure cuff bladder width should be approximately 40% of the arm circumference. Question 7. The resident refuses to eat vegetables with meals or as snacks. The CNA should: Option A. Sit with them until they eat a small portion. Option B. Have dietary increase the amount of vegetables. Option C. Notify the nurse so nutrition can be evaluated. Option D. Hold all desserts until they eat vegetables. The correct answer is option C. Notify the nurse so nutrition can be evaluated. Persistent refusal of food groups can lead to malnutrition. The aide's role is to report the behavior for assessment. Question 8. The CNA is aware that the resident is sleeping more than usual and has a lack of interest in once loved activities. These are signs of which disorder? Option A. Anger. Option B. Depression. Option C. Frustration with staff. Option D. Alzheimer's disease. The correct answer is option B. Depression. Withdrawal and loss of interest are classic clinical signs of depression in the elderly. Question 9. Which of the following interventions should the CNA use to promote skin integrity? Option A. Pad bony prominences when in bed. Option B. Leave TED stockings on during the night. Option C. Provide the client with additional blankets. Option D is slide the client up to reposition them. The correct answer is option A. Pad bony prominences when in bed. Padding bony prominences reduces direct pressure on areas like the sacrum and heels to prevent ulcers. Question 10. The care plan indicates a client should be repositioned every 2 hours when in bed. What is the reason for this? Option A. Increase client comfort. Option B. Provide the opportunity to check in. Option C. Decrease fall risk. Option D. Prevent skin breakdown. The correct answer is option D. Prevent skin breakdown. Frequent repositioning is necessary to prevent prolonged pressure, which leads to tissue ischemia and skin breakdown. Question 11. The CNA is caring for an infant in the nursery. Which route is the most accurate for a temperature? Option A. Orally. Option B. Rectally. Option C. Temporally. Option D. Axillary. The correct answer is option B. Rectally. The rectal route is considered the most accurate method for obtaining a core body temperature in infants. Question 12. If asked to sign a residence, will the CNA should? Option A. Agree but refuse any compensation. Option B. Decline and notify the nurse. Option C. Arrange for case management to assist. Option D. Tell the resident a family member must sign. The correct answer is option B. Decline and notify the nurse. Aide should not involve themselves in the legal or financial affairs of residents to avoid conflict of interest. Question 13. Contact precautions include which of the following? Option A. Mask, gown and gloves. Option B. Gloves and gown. Option C. Mask, gown, gloves and face shield. Option D. Mask, gown, gloves and shoe covers. The correct answer is option B. Gloves and gown. Standard contact precautions require the use of a gown and gloves to prevent spread via touch. Question 14. The nurse aide is assigned to measure a resident's height. The resident is unable to stand. What should the aide do? Option A. Estimate the height by looking. Option B. Use a tape measure to measure length in bed. Option C. Wait until the resident is strong enough to stand. Option D. Ask the family what the height was last year. The correct answer is option B. Use a tape measure to measure length in bed. If a resident is bedbound, height should be measured using a tape measure while the resident is lying flat. Question 15. The CNA is turning a patient during rounds. What is the best way to ensure the Foley catheter is not pulled out? Option A. Ensure the catheter is secured to the inner thigh. Option B. Hang the Foley bag on the bed frame. Option C. Tell the patient to hold the bag. Option D. Tape the Foley catheter to the outer thigh. The correct answer is option A. Ensure the catheter is secured to the inner thigh. The catheter should be secured to the resident's leg to prevent tension on the urethra during movement. Question 16. The patient who is bedbound is at risk for which of the following? Option A. Dysphagia. Option B. Polydipsia. Option C. Atrophy. Option D. Neck paralysis. The correct answer is option C. Atrophy. Atrophy is the wasting away of muscle tissue due to lack of use, which is a risk for patients with limited mobility. Question 17. The CNA found unlabeled pills on the resident's nightstand. What is the CNA's next step? Option A. Provide water and insist the resident take them. Option B. Discard them. Option C. Leave them alone to respect confidentiality. Option D. Notify the nurse immediately. The correct answer is option D. Notify the nurse immediately. Any unidentified medication is a safety hazard and must be reported to the nurse immediately. Question 18. A resident is acting out and having behavioral disturbances. What should the assistant do first? Option A. Encourage the family to move the resident. Option B. Provide for patient and staff safety. Option C. Isolate the resident from others. Option D. Call the police to pick up the resident. The correct answer is option B. Provide for patient and staff safety. In any situation involving behavioral disturbances, the primary responsibility is to ensure a safe environment for everyone. Question 19. A nurse aide is preparing a bed bath. Which action best supports the resident's right to privacy? Option A. Leaving the room door open for ventilation. Option B, closing the door and pulling the privacy curtain. Option C, telling the roommate to leave the room. Option D, explaining the procedure in a loud, clear voice. The correct answer is option B, closing the door and pulling the privacy curtain. Personal care must be conducted in a private environment. Closing doors and curtains is mandatory. Question 20. The CNA is performing CPR on an adult patient. At what rate should compressions be performed? Option A, 100 to 120 per minute. Option B, 60 to 100 per minute. Option C, 80 to 120 per minute. Option D, 120 to 160 per minute. The correct answer is option A, 100 to 120 per minute. Current AHA guidelines specify a compression rate of 100 to 120 compressions per minute for an adult. Question 21. What is the proper measurement for measuring bodily fluids? Option A, ounces. Option B, liters. Option C, milliliters. Option D, fluid ounces. The correct answer is option C, milliliters. Milliliters, ml, is the standard metric unit used in healthcare for the precise documentation of intake and output. Question 22. A resident wants a copy of their medical records. The CNA should: Option A, make a copy and give it to them. Option B, inform them that copies cannot be given. Option C, notify the resident's family about the request. Option D, provide the record release forms and advise the supervisor. The correct answer is option D, provide the record release forms and advise the supervisor. Residents have a legal right to their records, but the process must be handled by administrative supervisors. Question 23. The CNA witnesses a nurse giving milk to a patient with a milk allergy. What is the CNA's next action? Option A, nothing, it is not your concern. Option B, report this to the nursing supervisor. Option C, yell loudly for the nurse to stop. Option D, tell the patient that you are sorry. The correct answer is option B, report this to the nursing supervisor. The aide has an ethical and legal duty to report any unsafe practice to a supervisor to protect the patient. Question 24. Which is the best way to take an apical pulse? Option A, to the right of the sternum under the clavicle. Option B, on the back at the 5th intercostal space. Option C, right of the sternum at the 5th intercostal space. Option D, left of the sternum at the 5th intercostal space at midclavicular line. The correct answer is option D, left of the sternum at the 5th intercostal space at midclavicular line. The apical pulse is measured using a stethoscope placed at the 5th intercostal space at the midclavicular line on the left side. Question 25. Two unmarried adult residents are cuddling in the common area. They are content and not bothering anyone. The CNA should: Option A, separate them. Option B, escort them to a private room. Option C, notify their families. Option D, allow them to enjoy each other's company. The correct answer is option D, allow them to enjoy each other's company. Residents have a right to consensual social and romantic relationships as long as it does not infringe on others. Question 26. A resident tells you she cannot eat a meal because of her religious beliefs. What is your next step? Option A, tell her the kitchen is closed and she must wait. Option B, tell the resident to call a family member for food. Option C, contact the nurse and assure her you will bring a correct tray. Option D, tell the patient to call a pizza delivery service. The correct answer is option C, contact the nurse and assure her you will bring a correct tray. Respecting religious dietary restrictions is part of person-centered care. The aide should facilitate a replacement meal. Question 27. The CNA is assisting a client on swallowing precautions. Which should be included in the plan of care? Option A, client should not be left unattended when eating. Option B, give the client the regular dietary menu. Option C, instruct the client to tip their head back to swallow. Option D, no additional precautions are needed for soft foods. The correct answer is option A, client should not be left unattended when eating. Patients with swallowing difficulties are at high risk for aspiration and should never be left alone while eating. Question 28. Which should be included when repositioning a patient higher in the bed? Option A. Lower the height of the bed to the lowest position. Option B. Raise the head of the bed. Option C. Lower the head of the bed. Option D. Grasp the client under the arms and pull. The correct answer is option C. Lower the head of the bed. Lowering the head of the bed to a flat position makes it easier to move the patient upward and reduces physical strain. Question 29. The nurse aide is caring for a patient with stress incontinence. What is necessary for this patient? Option A. A Foley catheter to keep the skin dry. Option B. A frequent toileting breaks throughout the day. Option C. Less fluids to keep them from urinating. Option D. Diuretics to help keep the bladder empty. The correct answer is option B. Frequent toileting breaks throughout the day. Stress incontinence can be managed by scheduled toileting to keep the bladder empty and reduce accidents. Question 30. A resident's family member provided a pornographic magazine. The CNA should: Option A. Remove the magazine and discard it. Option B. Ask them to keep it in their room to avoid offending others. Option C. Take it to a supervisor. Option D. Encourage them to watch videos on the internet. The correct answer is option B. Ask them to keep it in their room to avoid offending others. Residents have a right to possess personal items but should be encouraged to keep them in their private room out of respect for others. Question 31. You are performing CPR on an adult patient. What is the correct depth per compression? Option A. 1 inch. Option B. 2 inches. Option C. 1.5 to 2.5 inches. Option D. 2.5 to 5 inches. The correct answer is option B. 2 inches. For an adult, chest compressions must be at least 2 inches deep to effectively circulate blood to the brain. Question 32. A resident tells the aide they have a decision to make about a personal issue. What is the best way to respect independence? Option A. Suggest legal counsel. Option B. Actively listen to the resident. Option C. Ask them to speak with the social worker. Option D. Encourage them to listen to their family. The correct answer is option B. Actively listen to the resident. Active listening supports the resident's autonomy and allows them to process their own decisions. Question 33. The nurse aide observes a resident sweating, feeling dizzy, and appearing anxious. What is the first step? Option A. Call for the nurse immediately and stay with the resident. Option B. Offer the resident a glass of water. Option C. Help the resident brush their teeth. Option D. Leave the room to find a glucose monitor. The correct answer is option A. Call for the nurse immediately and stay with the resident. Sweating and dizziness are signs of a serious medical issue. The aide must stay with the resident and summon help. Question 34. A coworker asks for help lifting a resident who has fallen but does not explain how it happened. What is the best action? Option A. Help the coworker lift the resident. Option B. Ask the resident if they are in pain before moving. Option C. Stay with the resident and tell the coworker to get the nurse. Option D. Wait until the resident is back in bed to report. The correct answer is option C. Stay with the resident and tell the coworker to get the nurse. A resident who has fallen must be assessed by a nurse for fractures or head injuries before being moved. Question 35. A resident is refusing a shower and has not had one in 3 days. How would you respond? Option A. Tell him he must take a shower so you do not get in trouble. Option B. Tell him you will call his daughter. Option C. Gently force him into the bathroom. Option D. Explain it is his right to refuse and you can try again tomorrow. The correct answer is option D. Explain it is his right to refuse and you can try again tomorrow. Residents have the legal right to refuse care. The aide should respect the refusal and offer again at a later time. Question 36. The CNA understands that elderly residents volunteering or exploring hobbies provides which of the following? Option A. Gives a sense of purpose. Option B. Respects privacy. Option C. Makes the person feel younger. Option D. Prevents depression. The correct answer is option A, gives a sense of purpose. Maintaining social engagement provides elderly residents with a sense of purpose and self-worth. Question 37. A pulse oximeter is a medical device used to measure. Option A, the level of carbon dioxide in the blood. Option B, the percentage of oxygen in the blood. Option C, the depth and rate of respirations. Option D, the pressure within the arteries. The correct answer is option B, the percentage of oxygen in the blood. A pulse oximeter measures oxygen saturation, which is the percentage of hemoglobin saturated with oxygen. Question 38. The CNA is caring for a patient receiving end-of-life care. Which task is appropriate? Option A, range of motion exercises to increase strength. Option B, providing optimal comfort to the patient and family. Option C, activities and games to prevent forgetfulness. Option D, keeping meals on a regular schedule. The correct answer is option B, providing optimal comfort to the patient and family. End-of-life care focuses on the quality of life and providing comfort for the patient and their loved ones. Question 39. The Aide notices a patient has multiple bruises in different stages of healing. What is the next step? Option A, report possible abuse to the abuse hotline. Option B, report your findings to the nurse. Option C, report the possible abuse to the police. Option D, report the bruises to the patient's family. The correct answer is option B, report your findings to the nurse. Nurse aides are mandated reporters. Any signs of potential abuse must be reported immediately to the nurse in charge. Question 40. A resident's room is sloppy and the resident will not tidy up. The CNA should. Option A, clean the room while the resident is away. Option B, insist the resident put things away or they will be tossed. Option C, explain that some items are a safety hazard and help relocate them. Option D, notify the power of attorney. The correct answer is option C, explain that some items are a safety hazard and help relocate them. Clutter is a fall hazard. The aide should explain the risk and work with the resident to organize the space. Question 41. A resident wanders into other residents' rooms at night. What should the nurse aide answer the family? Option A, I will put a belt restraint on him. Option B, I will use the linen cart to barricade the path. Option C, I will ask the nurse for sleeping pills. Option D, I will ask the nurse if we can get a sitter to stay with him. The correct answer is option D, I will ask the nurse if we can get a sitter to stay with him. Continuous supervision is the safest and least restrictive intervention for wandering. Question 42. The CNA is aware of the importance of meeting emotional needs. Checking on the resident and keeping the call light and reach meets which need? Option A, quality time. Option B, sense of purpose. Option C, safety and security. Option D, privacy. The correct answer is option C, safety and security. Providing a safe environment and ensuring a way to call for help meets the human need for safety and security. Question 43. A nurse aide enters a room without knocking while you are providing care. What is the best response? Option A, please knock next time to respect the patient's privacy. Option B is say nothing to avoid a conflict. Option C, you should have knocked first. Option D, say to the resident she is always rude like this. The correct answer is option A, please knock next time to respect the patient's privacy. Aides have a duty to protect resident privacy. Reminding a coworker to knock is a professional way to enforce standards. Question 44. The CNA is performing CPR with a second rescuer. At what rate should CPR be performed? Option A, 100 to 1. Option B, 30 to 2. Option C, 15 to 2. Option D, 45 to 1. The correct answer is option B, 30 to 2. For an adult with 2 rescuers, the compression to ventilation ratio remains 30 compressions to 2 breaths. Question 45. Which activity can be completed by a nurse aide? Option A, administering intravenous medication. Option B, addressing a wound. Option C, assisting with bathing. Option D, to assess change in mental status. The correct answer is option C, assisting with bathing. Nurse aides are trained to assist with activities of daily living such as bathing. Meds and assessments are outside their scope. Question 46. What is the best way to speak to an agitated client? Option A, in a soft voice. Option B, in a questioning voice. Option C, in a calm voice. Option D, in a loud voice. The correct answer is option C, in a calm voice. In a calm voice. When a client is agitated, do not escalate the situation. Speak in a calm and assertive voice and try to find out why the client is agitated. Use simple sentences and don't argue or disagree. Ensure the client is safe. Question 47. If the CNA sees a coworker spill water while bringing a pitcher to a resident, what is the CNA's best action? Option A, quickly wipe up the spill. Option B, task housekeeping to clean up the spill. Option C, report the colleague to the nurse. Option D, wait and tell the coworker to clean their mess. The correct answer is option A, quickly wipe up the spill. Quickly wipe up the spill. A spill is a safety hazard for everyone. Every team member is responsible for safety and should respond quickly. Any other option wastes time and is unnecessary. Question 48. The CNA is preparing a surgical postoperative bed. Where is the top sheet placed? Option A, no sheet is placed on the bed. Option B, fan folded at the side of the bed. Option C, fan folded at the end of the bed. Option D, folded at the head of the bed. The correct answer is option B, fan folded at the side of the bed. Fan folded at the side of the bed. The top sheet is left untucked at the foot of the bed. The top sheet is fan folded together at the side away from the door. When the client is transported, the gurney can easily be positioned next to the bed. Then the client is gently moved onto the bed and covered by the top sheet and blanket. Question 49. According to the Patient Bill of Rights, clients have the right to all of the following except: Option A, make decisions. Option B, free healthcare. Option C, refuse treatment. Option D, expect confidentiality. The correct answer is option B, free healthcare. Free healthcare. The Patient Bill of Rights describes what clients can expect when receiving healthcare. It does not include the guarantee of free healthcare. Question 50. The CNA is working on a hospital surgical unit. Which of the following post-op clients will require log rolling? Option A, a client recovering from spinal fusion. Option B, a client recovering a kidney transplant. Option C, a client recovering from abdominal surgery. Option D, a client recovering from a knee replacement. The correct answer is option A, a client recovering from spinal fusion. A client recovering from spinal fusion. Log rolling is a positioning technique that maintains spinal alignment and prevents further injury. The bed is in a flat position. At least 2 healthcare workers are needed to turn the client with one single motion. Question 51. While brushing a client's hair, the CNA observes several sores on the scalp. What is the CNA's best action? Option A, report the sores to the nurse. Option B, shampoo the client's hair and scalp. Option C, apply antibiotic ointment to the sores. Option D, ask the family to provide lotion. The correct answer is option A, report the sores to the nurse. Report the sores to the nurse. The CNA should report all observations and changes to the nurse. The nurse can then assess the client and determine proper action. The CNA scope of practice includes providing basic care and assisting with the ADLS under the supervision of a licensed nurse. Question 52. After a client receives an enema, what should the CNA be prepared to do? Option A, encourage the client to ambulate. Option B, assist the client to the toilet. Option C, place the client in a prone position. Option D, offer the client a meal tray. The correct answer is option B, assist the client to the toilet. Assist the client to the toilet. Following an enema, the client is instructed to remain on their left side, Sims position, and hold the solution for as long as possible, about 5 to 10 minutes. The CNA should be available to assist the client to the toilet when the client feels the need. Question 53. When taking a client's vital signs, the client tells the CNA that they are experiencing constipation. When the CNA notifies the nurse, what diet can the CNA expect the client to receive? Option A, full liquid. Option B, high fiber. Option C, residue free. Option D, low sodium. The correct answer is option B, high fiber. High fiber. Constipation can be relieved by a high fiber diet. Fiber adds bulk to the stool and helps push food through the intestines more quickly. Fiber-rich foods include fruits, vegetables, grains, and nuts. Question 54. The CNA is caring for a client who is recovering from major surgery. The client speaks a different language and seems to have many questions. What is the best way for the CNA to communicate with this client? Option A, contact the hospital's translation service. Option B, rely on a smartphone translation app. Option C, ask the client's family to translate. Option D, use gestures and facial expressions. The correct answer is option A, contact the hospital's translation service. Contact the hospital's translation service. This is the best option for legal medical issues. Family members may be helpful for understanding more about the client, but misinterpretation is possible. Smartphones and gestures can also be helpful, but not for legal medical issues. Question 55. Which of the following should be reported immediately to the nurse? Option A, weight gain of 6 pounds since yesterday. Option B, respirations of 16 breaths/minute. Option C, blood pressure of 114/70. Option D, blood glucose of 75 mg/dl. The correct answer is option A, weight gain of 6 pounds since yesterday. Weight gain of 6 pounds since yesterday. A gain of more than 3 pounds suddenly can be a sign of sudden fluid retention from heart, kidney, or liver. A BP of 114/70 may be low or normal for the client, so the CNA should check previous readings before informing the nurse. A blood glucose of 75 mg/dl is near the low range for a client with diabetes. It should be reported, but is not urgent. For clients without diabetes, 55 mg/dl is considered low. The normal range of respirations is 12-20/min. Question 56. HIPAA guarantees a patient which of the following rights? Option A, informed consent. Option B, respectful care. Option C, protecting information. Option D, active participation. The correct answer is option C, protecting information. Protecting information. HIPAA guarantees patients the right to confidentiality and privacy regarding their health information, including access to their records, the ability to request corrections, and control over how their information is used and shared. The other options are included in the Patient Bill of Rights. Question 57. A phlebotomist is a medical professional who is trained to: Option A, perform brain surgery. Option B, draw blood samples. Option C, administer ECGs. Option D, provide hospice care. The correct answer is option B, draw blood samples. Draw blood samples. Phlebotomists are healthcare team members who are trained to perform blood draws on children and adults. They draw blood and collect samples from clients and prepare it for testing. They are skilled at venipuncture, finger pricks, and heel pricks. They can also work at blood banks, collecting blood and products. The other options are incorrect. Question 58. The CNA enters a resident's room and discovers a fire in the wastebasket. The resident is about to enter their room. What is the first priority? Option A, extinguish the fire if possible. Option B, activate the fire alarm system. Option C, confine the fire by closing doors. Option D, remove the resident from the area. The correct answer is option D, remove the resident from the area. Remove the resident from the area. The CNA should first remove the resident, as well as anyone else who is nearby, away from the area. When there is a fire, the most important action is to rescue everyone in imminent danger. Next, the CNA should activate the fire alarm, then contain the fire by closing doors. If possible, the CNA can extinguish the fire. If not, then evacuate. R rescue/remove A, activate the alarm. C, contain E, extinguish/evacuate. Question 59. When the CNA forgets to lock the wheels on a wheelchair and the client falls, what should the CNA be charged with? Option A, negligence. Option B, battery. Option C, malpractice. Option D, assault. The correct answer is option A, negligence. Negligence. The CNA could be charged with negligence because they did not use medical equipment properly, or as they were trained to do. Malpractice is when actions or failure to act do not follow the accepted standard of care, resulting harm or injury to a patient. Assault is when someone creates a reasonable fear of imminent harm. Batter is actual and unlawful physical contact or harm on another person. Question 60. Using a 24-hour clock, how is 3 p.m. written? Option A, 1500 hours. Option B, 1:30. Option C, 3 o'clock. Option D, 30:00. The correct answer is option A, 1500 hours. 1500 hours. Using the 24-hour clock, time is written in HHMM format, hour minute. Time starts at midnight, and goes through 23:59, 11:59 p.m. Minutes go from 00 to 59, so 3 p.m. is 1500 hours. Hours before 10 a.m., 10 o'clock, are written with a 0 in front, so 9 a.m. is written as 9 o'clock. Question 61. Which of the following observations by the CNA should be reported immediately to the nurse? Option A, client reports a sudden loss of vision in one eye. Option B, client reports poor sleep because of noise on the unit. Option C, client reports an improvement in their appetite. Option D, client reports muscle soreness after physical therapy. The correct answer is option A. Client reports a sudden loss of vision in one eye. Client reports a sudden loss of vision in one eye. Losing vision suddenly is a medical emergency and requires immediate treatment. Vision can be lost in one or both eyes, loss of partial vision, or loss of central vision. There are several causes of loss of vision, including a stroke. The other observations should also be reported to the nurse, but they are not medical emergencies. Question 62. When giving a new resident an orientation to their room, which of the following instructions is most important? Option A, how to change TV channels. Option B, how to adjust the room temperature. Option C, how to use the call signal. Option D, how to flush the toilet. The correct answer is option C, how to use the call signal. How to use the call signal. Learning to use the call signal is the most important thing for a new resident to learn. The resident should understand when to use it and how staff will respond. Explain that it's for the resident's safety. The other items are useful, but not the most important. Question 63. When providing client care, standard precautions are required for all of the following body fluids and secretions except Option A, urine. Option B, sweat. Option C, vomit. Option D, blood. The correct answer is option B, sweat. Sweat. Standard precautions are the basic level of infection control that should be used in the care of all patients all of the time. They apply to blood, all body fluids, secretions and excretions, except sweat, whether or not they contain visible blood, non-intact skin, and mucous membranes. Standard precautions include hand hygiene, respiratory hygiene, PPE, cleaning/disinfection, and waste disposal. Question 64. Before collecting a sputum sample, what should the CNA ask the client to do? Option A, rinse their mouth with filtered water. Option B, spit into a kidney basin for 1 minute. Option C, avoid drinking fluids for 30 minutes. Option D, rinse their mouth with mouthwash. The correct answer is option A, rinse their mouth with filtered water. Rinse their mouth with filtered water. This is to remove any food or particles. The best time to collect the specimen is in the early morning. Procedure 1. Use a clean container, do not open it until ready to collect the sputum. 2. Ask client to rinse their mouth with water and spit it out. 3. Ask client to take deep breaths through their mouth and cough up sputum from deep in their lungs. 4. Open the container and hold it close to the client's mouth. Ask the client to cough directly into the container. About 1 to 2 teaspoons is enough. 5. After collected, screw lid on tightly, label and bag the container according. Question 65. When the CNA delivers a breakfast tray to a Muslim client, the client refuses to eat because the tray includes bacon. What should the CNA do? Option A, tell the client to eat everything except the bacon. Option B, ask the nurse to order a halal breakfast for the client. Option C, remind the client that the hospital dietitian knows best. Option D, take the tray and give the client juice and crackers. The correct answer is option B. Ask the nurse to order a halal breakfast for the client. Ask the nurse to order a halal breakfast for the client. The CNA should remove the tray and ask the nurse for a halal option. The nurse can also change the client's diet on the care plan. Question 66. Before transferring a client from their bed to a wheelchair, what is the first thing the CNA should do? Option A. Lock the wheels of the bed and the wheelchair. Option B. Let the client dangle their legs before standing. Option C. Raise the head of the client's bed. Option D. Assist the client to a full sitting position. The correct answer is option A. Lock the wheels of the bed and the wheelchair. Lock the wheels of the bed and the wheelchair. This prevents falls during transfer. Once the wheels are locked, can help put on footwear, assist the client to the edge of the bed to dangle their legs and carefully stand and pivot toward the wheelchair. Ensure client's legs are in contact with the seat of the chair before lowering them into position. Question 67. The CNA who works at a long-term facility is introducing themselves to a new resident, Mary Hudson. What is the best way to learn how the resident wishes to be addressed? Option A. Wait until learning what the nurse calls her. Option B. Call her by her first name, Mary. Option C. Ask her family how to address her. Option D. Ask her how she would like to be addressed. The correct answer is option D. Ask her how she would like to be addressed. Ask her how she would like to be addressed. It's important to be respectful. Do not call someone by their first name until you get their permission. Unless the resident is unable to speak, ask them directly how they would like to be addressed. Always introduce yourself first, tell the resident your title and how you'll be caring for them. Question 68. After helping a client to use the toilet, the CNA prepares to provide perineal care before returning the client to their bed. If the CNA discovers there are no washcloths or wipes in the bathroom, what is the best action? Option A. Tell the client to remain still and quickly leave to get supplies. Option B. Return the client to their bed and then perform perineal care. Option C. Use the bathroom call light to ask a team member to bring supplies. Option D. Wait until the next toileting to provide complete perineal care. The correct answer is option C. Use the bathroom call light to ask a team member to bring supplies. Use the bathroom call light to ask a team member to bring supplies. The CNA should remain with the client, never leave a client unattended when they need assistance to use the bathroom. It is inappropriate to postpone perineal care. Question 69. Which of the following is the best way to clean the indwelling urinary, Foley, catheter tubing? Option A. Use a gentle back and forth circular motion all along the length of the tubing. Option B. After cleaning the perineum and upper legs, start where the tubing enters the body and move down to the collection bag. Option C. Start at the collection bag and move up to where the tubing enters the body. Option D. Use a firm up and down motion all along the length of the tubing. The correct answer is option B. After cleaning the perineum and upper legs, start where the tubing enters the body and move down to the collection bag. After cleaning the perineum and upper legs, start where the tubing enters the body and move down to the collection bag. Question 70. What is the most effective way to prevent the spread of infection? Option A. Remaining home when sick. Option B. Getting recommended vaccinations. Option C. Proper hand hygiene. Option D. Appropriate use of gloves. The correct answer is option C. Proper hand hygiene. Proper hand hygiene. Hand washing is the most effective way to prevent the spread of bacteria and viruses. Using soap and water is the preferred method. Alcohol-based hand sanitizer is also effective. Question 71. The CNA observes a client taking money from the purse of a visitor. What is the CNA's best action? Option A. Tell the visitor about the theft. Option B. Continue to do assigned work as usual. Option C. Approach the client and demand the money. Option D. Inform the nurse about what happened. The correct answer is option D. Inform the nurse about what happened. Inform the nurse about what happened. The CNA has an ethical duty to report the theft but does not have the authority to intervene. The CNA should let the nurse or supervisor know, because that person is responsible for handling incidents and ensuring all policies are followed correctly. Question 72. The CNA enters a client's room and finds that the client has fallen to the floor. What is the most important thing for the CNA to do? Option A. Call for help and start CPR. Option B. Call for help and turn the client on their side. Option C, call for help and return the client to their bed. Option D, call for help and remain with the client. The correct answer is option D, call for help and remain with the client. Call for help and remain with the client. If the CNA discovers a client on the floor, they should call for help and remain with the client. Trying to move the client back to bed could cause further injury. Turning a client on their side is an appropriate action or an active seizure to prevent the client from aspirating. There is no indication that the client is unresponsive or not breathing, so initiating CPR is not appropriate. Question 73. The CNA is feeding a client with Alzheimer's disease. During the meal, when should fluids be offered? Option A, throughout the meal. Option B, before starting to feed. Option C, only at the end of the meal. Option D, after each bite of food. The correct answer is option A, throughout the meal. Throughout the meal, fluids should be offered at regular intervals during the entire meal to help the client's mouth stay moist. It makes it easier for the client to chew and swallow. Clients who may require feeding include those with cognitive impairments. Question 74. A resident with dementia has difficulty understanding explanations about their care. What is the most appropriate way to communicate with the resident? Option A, speak slowly and loudly to make sure the client hears. Option B, use simple words and demonstrate what is happening. Option C, avoid as much verbal communication as possible to reduce confusion. Option D, give detailed instructions so the client has more information. The correct answer is option B. Use simple words and demonstrate what is happening. Use simple words and demonstrate what is happening. When communicating with a client who has dementia, use simple words and short sentences. Demonstrating what is happening or how to do something is also helpful. Avoiding communication is not good client care or respectful. Giving detailed instructions only adds to the client's confusion. Speaking slowly and loudly is not useful or respectful. Question 75. While assisting a resident with their shower, the CNA observes a reddened area on the resident's sacrum. The area does not blanch, turn white, when the CNA presses it. What stage is this pressure sore? Option A, stage I. Option B, stage 2. Option C, stage 4. Option D, stage 3. The correct answer is option A, stage I. Stage I is stage 1, a red or blue area that may look like a bruise. It does not turn white when pressed. The skin is not broken, it may feel warm to the touch. Stage 2, area becomes an open sore that looks like an abrasion or a blister. The skin around the sore may be discolored and the client may complain of pain. Stage 3, sore deepens and looks like a crater, usually dark patches of skin around the edges. Stage 4, the sore now extends to muscle, bone, or joints and cause a serious bone infection, osteomyelitis. Question 76. The CNA is assigned to care for a client with measles, which requires airborne precautions. All of the following PPE is required except Option A, booties. Option B, gloves. Option C, gown. Option D, N95 mask. The correct answer is option A, booties. Booties. PPE for airborne includes gloves, gown, and N95. The client's door should also remain closed with a notice on the door. Booties are not required. Question 77. A client has an irregular heartbeat. When taking the client's pulse, how long should the CNA count? Option A, 60 seconds. Option B, 30 seconds. Option C, 15 seconds. Option D, 45 seconds. The correct answer is option A, 60 seconds. 60 seconds. When a pulse is irregular, it should be measured for a full minute. With heartbeats that are not consistent, counting for 60 seconds is the best way to be accurate. When a pulse is regular, 30 seconds, multiplied by 2, is adequate. Question 78. The CNA finds a terminally ill client crying alone in their bed. What is the CNA's best action? Option A, leave the room to provide privacy. Option B, offer to sit with the client for a while. Option C, encourage the client to watch TV. Option D, tell the client that everything will be okay. The correct answer is option B, offer to sit with the client for a while. Offer to sit with the client for a while. The client may feel lonely, scared, depressed, or anxious. They may want to talk to someone who can listen with empathy. Family and friends may stay away because they don't know what to say. The client may just want someone to be nearby. Ask them what they need. Do not deny the client's feelings or try to distract the client. Question 79. The CNA who works in a pediatric clinic weighs an infant and documents 4.6 kilograms. What is the infant's weight in pounds? Option A 8.2 pounds. Option B 6.9 pounds. Option C 10.12 pounds. Option D 2.09 pounds. The correct answer is option C, 10.12 pounds. 10.12 pounds. To convert kilograms to pounds, multiply the number of kilograms by 2.2. For this question, 4.6 kilograms x 2.2 equals 10.12 pounds. Question 80. The purpose of active range of motion exercises is to prevent which of the following? Option A, loss of joint motion. Option B, pressure sores. Option C, migraine headaches. Option D, poor circulation. The correct answer is option A, loss of joint motion. Loss of joint motion. Active range of motion, AROM, maintains and improves joint function. Unlike passive range of motion, AROM requires the client to contract muscles which keeps them strong. It can also help relieve pain by increasing blood flow to the joints. Question 81. A client is scheduled for major abdominal surgery at 1 p.m., 1300 hours. When their breakfast tray arrives at 7 a.m., 7 o'clock, what food should be on the tray? Option A, chicken broth and apple juice. Option B is scrambled eggs and toast. Option C, pancakes and bacon. Option D, no tray client is NPO. The correct answer is option D, no tray client is NPO. No tray client is NOP. Generally, a client should be NPO for 8 hours before surgery. Their stomach should be empty before receiving anesthesia to avoid aspiration and complications. Having any food can cause the surgery to be cancelled. If the client does receive array, the CNA should check with the nurse. Question 82. When preparing to give a bed bath, what is the last thing to do? Option A, provide privacy for the client. Option B, gather all bathing supplies. Option C, fill the water basin, S. Option D, explain the process to the client. The correct answer is option C, fill the water basin, S. Fill the water basin, S. To minimize cooling time, the last step is to fill the water basin. Water for a bed bath should be 105 to 115 Fahrenheit. If a thermometer is not available, the water should feel comfortable against the CNA's arm. Explain the process, gather supplies, provide privacy, then water. Question 83. Which of the following tasks is within the CNA's scope of practice? Option A, teaching a client how to care for their catheter. Option B, obtaining a clean catch urine sample. Option C, making a change in a client's care plan. Option D, giving a client a Tylenol for their headache. The correct answer is option B, obtaining a clean catch urine sample. Obtaining a clean catch urine sample. The CNA can only perform tasks they learn through their training or assigned by a nurse. They cannot decide what a client needs. They can assist with ADLS, collecting specimens for testing, checking and documenting vital signs, moving and transporting clients, and reporting changes in condition. CNA may not provide teaching, administer meds/injections or change the care plan. Question 84. The CNA is caring for a resident with a known history of sundowner syndrome. Which of the following symptoms should the CNA be most alert for? Option A, increased difficulty swallowing. Option B, a sudden craving for sugary food. Option C, increased confusion in the evening. Option D, sudden tendency to fall. The correct answer is option C, increased confusion in the evening. Increased confusion in the evening. Sundowning is a state of confusion that occurs in the late afternoon and continues into the night. Typically affects people with types of dementia. Causes behaviors that include confusion, anxiety, or aggression and wandering. Question 85. When counting fluids for intake and output, INO, what is the volume of 8 ounces, 8 ounces, of ice chips? Option A, 6 ounces. Option B, 4 ounces. Option C, 8 ounces. Option D, 2 ounces. The correct answer is option B, 4 ounces. 4 ounces. Ice chips are considered to be a fluid intake, but they melt to half their volume, so 8 ounces will melt to 4 ounces. The CNA should document 4 ounces of fluid. 1 ounce equals 30 milliliters. If fluid volume is measured in ml, multiply the number of ounces by 30, 4 ounces x 30 equals 120 milliliters. Question 86. During a transfer from their bed to a wheelchair, a client suddenly complains of pain. What is the CNA's best action? Option A, stop the transfer and return the client to bed. Option B, try a different method to complete the transfer. Option C, finish the transfer and then tell the nurse. Option D, call out for emergency assistance. The correct answer is option A. Stop the transfer and return the client to bed. Stop the transfer and return the client to bed. If a client suddenly complains of pain during a routine transfer, the CNA should immediately stop and return them to bed. The nurse can then assess the client, and another method may be used after the client has been assessed. The CNA should not ignore the complaint and continue the transfer. Question 87. A client's height is 5 feet 10 inches. How tall is the client in inches? Option A, 70 inches. Option B, 60 inches. Option C, 50 inches. Option D, 80 inches. The correct answer is option A, 70 inches. 70 inches. Question 88. The CNA is giving a bed bath. After washing the client's chest and stomach, which are of the body will the CNA wash next? Option A, arms. Option B, back. Option C, legs. Option D, face. The correct answer is option C, legs. Legs. When giving a bed bath, start with the cleanest areas and progress to the least clean. Use a fresh washcloth when needed. General order: eyelids, face, ears, neck, arms and hands, chest and stomach, legs, feet, back, groin and genitals, anal area. Question 89. To convert 4 ounces, Oz, of liquid milliliters, ml, the nurse aide should multiply 4 by option A, 30 ml, option B, 10 ml, option C, 5 ml, option D, 15 ml. The correct answer is option A, 30 ml. 30 ml. When converting milliliters to fluid ounces, 30 ml equals 1 ounce. Question 90. Which of the following is not considered a way to restrain a client? Option A, a hand mitt. Option B, a sedative. Option C, pain management. Option D, lap buddy/tray. The correct answer is option C, pain management. Pain management. A restraint may be either physical or chemical. Its purpose is to protect the client from harming themselves or others. Only a physician may order a restraint, and guidelines are strict. A pain medication may help calm a client or relieve behavior associated with severe pain, but it is not in the restraint category. Question 91. When taking a client's radial pulse, the nurse aide's fingertips should be placed on the client's option A, wrist, option B, chest, option C, elbow, option D, neck. The correct answer is option A, wrist. Wrist. A radial pulse is found at the client's wrist. To locate it, place your index and middle fingers on the hollow area below the thumb. Apply light pressure to feel the pulse. Count each beat for 30 seconds and multiply by 2 to get the pulse rate. If the client has an irregular heartbeat, count for 60 seconds. Question 92. The nurse aide notices that the client's radio cord is draped across a chair to reach the nearest outlet. The first thing the nurse aide should do is option A, tell the client the radio is a safety hazard and take it away. Option B, take the radio to the activities room and tell the client to listen there. Option C, see if any changes can be made so that the radio can be plugged in safely. Option D, unplug the radio and ask the client not to use it. The correct answer is option C. See if any changes can be made so that the radio can be plugged in safely. See if any changes can be made so that the radio can be plugged in safely. All facilities must comply with the electrical safety standards of governmental and accrediting agencies. Client devices, including radios or televisions, must be approved according to facilities' policies. The nurse aide can help the client find a place for the radio where the cord to be safely plugged in, so the client can continue to enjoy listening. Question 93. While eating dinner, A client starts to choke and turn blue. The nurse aide should: Option A, call for assistance and perform the Heimlich maneuver. Option B, give the client a drink of water. Option C, slap the client on the back until the food dislodges. Option D, to immediately remove the client's food tray and go find the nurse in charge. The correct answer is option A, call for assistance and perform the Heimlich maneuver. Call for assistance and perform the Heimlich maneuver. Calling for assistance as you prepare to do abdominal thrusts will alert others to the emergency. You can try a quick back slap, but if the food is not immediately dislodged, quickly start abdominal thrusts. Question 94. The purpose of padding side rails on the client's bed is to: Option A, protect the client from injury. Option B, have a place to connect the call signal. Option C, keep the client warm. Option D, use them as a restraint. The correct answer is option A, protect the client from injury. Protect the client from injury. Side rails can keep the clients from falling out of bed. Also, clients can grab onto the railing to reposition themselves. However, if the client is agitated, confused, or has a head injury or a history of seizures, padding the side rails can prevent injuries or entrapment. Question 95. The nurse aide is responsible for the following fire prevention measures except: Option A, taking cigarettes and matches away from all clients and visitors. Option B, reporting all damaged wiring or sockets in clients' rooms. Option C, participating in fire drills. Option D, being aware of the locations of fire extinguishers. The correct answer is option A, taking cigarettes and matches away from all clients and visitors. Taking cigarettes and matches away from all clients and visitors. While smoking by clients and visitors may not be appropriate, the nurse aide may not take away cigarettes or matches. However, the nurse aide can certainly report these actions to the charge nurse. The nurse aide should also be familiar with policies regarding smoking or smoking areas, to inform smokers if there are designated places. Question 96. The nurse aide is walking with a client confined to a wheelchair when the facility fire alarm system is activated. The client becomes excited from the noise. The nurse aide should: Option A, push the wheelchair out of the hallway and carry the client out of the facility. Option B, lock the client's wheelchair and check the surrounding area for smoke. Option C, comfort the client while moving the person to a safe place. Option D, leave the client to search for help. The correct answer is option C, comfort the client while moving the person to a safe place. Comfort the client while moving the person to a safe place. The nurse aide should be familiar with all fire safety policies and protocols. When a fire alarm sounds, all staff must respond to keep clients safe. Remember RACE. Question 97. The nurse aide is going to help the client walk from the bed to a chair. What should the nurse aide put on the client's feet? Option A, a cloth-soled slippers. Option B, rubber-soled slippers or shoes. Option C, socks or stockings only. Option D, nothing. The correct answer is option B, rubber-soled slippers or shoes. Rubber-soled slippers or shoes. When helping a client ambulate, you must prevent the client from falling. Proper footwear should always be worn for any type of walking, even short distances. Rubber-soled slippers or shoes provide traction to prevent falls. Question 98. To take an oral temperature, the nurse aide should: Option A, place the thermometer under the arm. Option B, put lubricant on the thermometer. Option C, place the thermometer in the rectum. Option D, place the thermometer under the tongue. The correct answer is option D, place the thermometer under the tongue. Place the temperature under the tongue. To take an oral temp, make sure client has not had anything hot or cold to eat or drink for 15 minutes. Place the thermometer under the client's tongue. A digital thermometer will beep when it registers the client's temperature. Question 99. To avoid pulling on the catheter while you're turning a male client, the catheter tube must be taped to his: Option A, bed sheet. Option B, upper thigh. Option C, hip. Option D, bed frame. The correct answer is option B, upper thigh. Upper thigh. An indwelling urinary catheter is used to drain the bladder into a bag outside the body. A catheter for males is a long tube with a balloon that is inflated after being inserted. The tube that drains the urine must not be tugged on or become kinked. In males, it is attached to the client's inner thigh by tape or a special fastening device. Never attach the tube to anything except the inner thigh. Question 100. The nursing care plan states, transfer with mechanical lift. However, the client is very agitated. To transfer the client, the nurse aide should: Option A, keep the wheels unlocked so the lift can move with the client. Option B, lift the client without the mechanical device. Option C, place the client in the lift. Option D, get assistance to move the client. The correct answer is option C. Place the client in the lift. Get assistance to move the client. Client safety is always your highest priority. Do not try to accomplish a task alone if a patient is unable to cooperate for any reason. It is important to follow the nursing care plan, including all the steps for operating any equipment being used to move or transfer the client. Ask a coworker to help if you have any concerns about keeping the client safe. If the client remains agitated, notify the nurse before proceeding. Question 101. Which of the following is the most comfortable position for a client with a respiratory problem? Option A, lateral. Option B, prone. Option C, supine. Option D, a Fowler's. The correct answer is option D, Fowler's. Fowler's. When a client is having difficulty breathing, the Fowler's position can provide relief. When sitting in the Fowler's position, the client is upright at 90 degrees, allowing the chest to expand as much as possible. Prone, on the abdomen, supine, on the back, and lateral, on the side, are all flat positions, which can make respiratory distress worse. Question 102. Insulin, a hormone, regulates. Option A, the strength of the skeletal muscles. Option B, the amount of salt retained in the blood. Option C, the amount of sugar in the blood. Option D, the rhythm of the heart. The correct answer is option C, the amount of sugar in the blood. The amount of sugar in the blood. Diabetes is a disease that results when the pancreas does not make enough insulin to decrease or control the amount of sugar in the blood. Clients with diabetes must check their blood sugar levels every day. To stay healthy, they require medication, which can include insulin injections. Question 103. Physical restraints are used most often. Option A, to prevent client injury. Option B, when staff is short. Option C, at the family's request. Option D, at the roommate's request. The correct answer is option A, to prevent client injury. To prevent client injury. Physical restraints are devices or equipment that prevent normal movement. Examples are arm or leg restraints, hand mitts, and vests. It is against the law to use restraints unless they are necessary to treat a client's medical symptoms or there is a risk of harming oneself or others, not for punishment, convenience, or control. Question 104. If the nurse aide discovers fire in a client's room, the first thing to do is: Option A, remove the client. Option B, call the nurse in charge. Option C, open a window. Option D, try to put out the fire. The correct answer is option A, remove the client. Remove the client. The nurse aide should be familiar with all fire safety and protocols. Remember RACE. Question 105. When operating a manual bed, the nurse aide should remember to: Option A, lock the wheels when the cranks are folded. Option B, keep the client's head elevated at all times. Option C, keep the bed in the neutral position. Option D, fold the cranks under the bed. The correct answer is option D, fold the cranks under the bed. Fold the cranks under the bed. When working a manual bed, first lock the bed by pressing down the levers on the wheels at the head and foot of the bed. At the end of the bed are 3 cranks which control the bed height, as well as raising and lowering the head and feet. Cranks are turned clockwise to raise each section, and counterclockwise to lower it. After positioning the client, always fold the cranks under the bed to prevent others from tripping or falling. Question 106. While making an empty bed, the nurse aide sees that the side rail is broken. The nurse aide should: Option A, wait for the next safety check to report the broken side rail. Option B, warn the client to be careful when he or she gets back into bed. Option C, report the broken side rail immediately. Option D, tie the side rail in the raised position until it is fixed. The correct answer is option C, report the broken side rail immediately. report the broken side rail immediately. Every staff member is responsible for keeping clients safe at all times. This includes monitoring all equipment and reporting when anything needs repair. Never use broken equipment or try to create a temporary fix for equipment that is not working properly. Tag the broken bed and move it so that another client can't use it. Replace it immediately with one that has functioning side rails. Question 107. What is the best way to keep a skilled nursing facility from having an unpleasant odor? Option A. There is nothing you can do. Option B. Keep all the windows open. Option C. Empty bedpans and change linens in a timely manner. Option D. Use an air freshener regularly. The correct answer is option C. Empty bedpans and change linens in a timely manner. Empty bedpans and change linens in a timely manner. All staff in a skilled nursing facility are responsible for maintaining a pleasant environment. Any source of odor must be dealt with at once. Bedpans and commodes should be emptied and cleaned as soon as the client finishes. All linens should be changed in accordance with the facility's policies and as needed. Question 108. A patient has a diagnosis of psoriasis. Her nurse aide should: Option A. Treat her the same way as any other patient with a non-infectious disease. Option B. Avoid contact with the highly contagious lesions. Option C. Wear a mask when entering the room. Option D. Wear gloves for patient care. The correct answer is option A. Treat her the same way as any other patient with a non-infectious disease. Treat her the same way as any other patient with a non-infectious disease. Autoimmune diseases are never contagious. They happen when the body's immune system attacks its own healthy tissue by mistake. Besides psoriasis, other autoimmune diseases include lupus, celiac, multiple sclerosis, and type 1 diabetes. Client care is the same as for any other client. Question 109. A nurse assistant notices red marks on a resident's back and buttocks. The aide acts in the knowledge that: Option A. Red marks are not a problem. Option B. Patients can only be turned every 2 hours. Option C. The skin can break down if nothing is done. Option D. It takes a doctor's order to rub skin with lotion. The correct answer is option C. The skin can break down if nothing is done. The skin can break down if nothing is done. A reddened area is the first sign of skin breakdown. It means that there is pressure and a lack of blood circulation to the area. The nurse aide should immediately reposition the client to eliminate pressure. Clients who are not mobile need to be repositioned at least every 2 hours. Never massage a reddened area, because this will only increase the damage. Keep the client clean from perspiration, urine, and feces. Continue to observe the skin and report to the nurse if the marks do not quickly disappear. Question 110. Which of the following should be reported immediately? Option A. A temperature of 99.4 Fahrenheit. Option B. A respirations of 12. Option C. A pulse of 90. Option D. A blood pressure of 90/40ths. The correct answer is option D. A blood pressure of 90/40ths. A blood pressure of 90/40ths. Low blood pressure, hypotension, is less than 90/60ths. Only one of the numbers has to be lower to consider hypotension. Some clients may have a normal blood pressure in the low range, but if there is a sudden drop from normal, immediately report to the nurse. Question 111. Who can order a warm or cold application? Option A. You as a CNA, if you think it is necessary. Option B. A nurse. Option C. A doctor. Option D. The director of nursing. The correct answer is option C. A doctor. A doctor. It is important to remember that only a doctor can order a treatment, test, or medication for a client. This includes even simple treatments such as hot and cold compresses. A nurse aide can be fired or lose certification for initiating treatments. Question 112. A professional and safe working appearance would include which of the following? Option A. Sandals, t-shirt, and a name tag. Option B. Clean, wrinkle-free uniform, short fingernails, and off-the-shoulder hair. Option C. Carefully manicured acrylic nails. Option D. Jewelry that reflects your fun personality. The correct answer is option B. Clean, wrinkle-free uniform, short fingernails, and off-the-shoulder hair. Clean, wrinkle-free uniform, short fingernails, and off-the-shoulder hair. Question 113. The circulatory system consists of the option A, blood vessels, lymph nodes, and spleen. Option B, blood vessels, arteries, veins, and capillaries. Option C, heart, arteries, veins, and capillaries. Option D, heart, aorta, pulmonary vessels, and lungs. The correct answer is option C, heart, arteries, veins, and capillaries. Heart, arteries, veins, and capillaries. The circulatory system is made up of the heart, arteries, veins, and capillaries. They are connected to make a complete circuit in the body. The heart pumps oxygenated blood from the lungs, as well as nutrients, through the arteries to the capillaries. The capillaries then deliver carbon dioxide and waste to the veins. The veins take the waste products to the liver and kidneys for disposal, and the carbon dioxide goes to the lungs to be exhaled. Question 114. Continuing education is option A, a professional standard. Option B, necessary for recertification in many states. Option C, important for keeping abreast of new developments. Option D, all of the above. The correct answer is option D, all of the above. All of the above. For healthcare professionals, learning does not end at graduation. Medicine is constantly changing, and it is the responsibility of each person to be aware of new developments in their area of practice. Also, clinical standards in many states require proof of continuing education in order to renew a license or certification. During an accreditation survey, hospitals and facilities must show proof that staff members are receiving ongoing training and education. Question 115. In a report, the nurse aide is told that one of her patients has been ordered NPO after midnight. The aide should: option A, note all water that the patient drinks and output. Option B, offer frequent snacks. Option C, take away the water pitcher at midnight. Option D, ask the patient if he or she is having any pain. The correct answer is option C, take away the water pitcher at midnight. Take away the water pitcher at midnight. NPO is a common medical term that means the client cannot eat or drink anything, including water or ice chips. A doctor may order a patient to be NPO before surgery or certain lab work. The nurse aide can provide mouth care for a client who is NPO. Placing an NPO sign over the client's bed and door will remind all staff members not to give the client anything to eat or drink. Question 116. The brain is part of the option A, locomotor system. Option B, exocrine system. Option C, nervous system. Option D, endocrine system. The correct answer is option C, nervous system. Nervous system. The nervous system has two parts. The brain and spinal cord make up the central nervous system, CNS. The peripheral nervous system, PNS, is made up of all the body's nerves, which connect to the CNS. The brain sends messages through the spinal cord and nerves to control the body's muscles and organs. It also processes and interprets the information from both inside and outside the body. Question 117. Most of our calories should come from option A, protein. Option B, carbohydrates. Option C, fats. Option D, vitamins. The correct answer is option B, carbohydrates. Carbohydrates. A balanced diet is essential for health. When the client consumes nutrients and the right combination of calories, the person's desired weight is maintained. Carbs supply fuel for the body, so 45 to 65% of calories should come from carbs. The energy is stored in the muscles and liver for immediate or future use, as well as for the brain to function. Question 118. Mrs. Sparks is an 83-year-old female patient who suffers from the late effects of the CVA. She has L-sided hemiplegia. Option A, vis isa, paralysis on the left side of the body. Option B, an L-arm contracture. Option C, L-arm and leg itching. Option D, a rash on the L-arm. The correct answer is option A, vis isa, paralysis on the left side of the body. Paralysis on the left side of the body. A client with left-sided hemiplegia has paralysis on the left side of the body. The paralysis can be either partial or total. It occurs on the opposite side of the CVA, stroke, or brain disorders. Mrs. Sparks had a CVA on the right side of the brain, resulting in left-sided paralysis. Question 119. A patient appears paler than usual. The nurse aide should: option A, noted on the chart. Option B, get the patient a snack. Option C, ask the patient how he feels and take his vital signs immediately. Option D, offer the patient a glass of water. The correct answer is option C. Ask the patient how he feels and take his vital signs immediately. Ask the patient how he feels and take his vital signs immediately. Whenever you notice a change in the client's condition, stop to assess the client and take vital signs. If the client is able to respond, ask the person how they feel. Report the change, vital signs, and client's response to the nurse. When charting, document what you observed and did. Question 120. Which of the following is recommended position for giving an enema? Option A, supine. Option B, prone. Option C, left sims. Option D is semifallers. The correct answer is option C, left sims. Left sims. The left sims position is used for rectal examinations and administering enemas. The client lies on the left side, with the right knee and hip bent. This position is also called the lateral recumbent or semi-prone side position. Question 121. Your resident consumed a bowl of soup that was 180 cubic centimeters of liquid. How many ounces was that? Option A, 7 ounces. Option B, 5 ounces. Option C, 6 ounces. Option D, 4 ounces. The correct answer is option C, 6 ounces. 6 ounces 180 cubic centimeters equals 6 ounces. When converting cubic centimeters, cc, to fluid ounces, oz, remember that 30 cubic centimeters equals 1 ounce. Although an ounce is slightly less, the amounts are considered equal by doctors and pharmacists. Also, 1 cubic centimeter equals 1 ml. Question 122. Mrs. Shumway's nursing care plan lists CHF, congestive heart failure, as her primary diagnosis. Diagnosis. You would expect her ADL routine to include which of the following? Option A, placement of TED hose after ambulation. Option B, a daily jog around the facility for 1 hour. Option C, daily weight measurement. Option D, encouraging oral fluids. The correct answer is option C, daily weight measurement. Daily weight measurement. CHF is a chronic disease that occurs when the heart becomes weak and is no longer able to pump efficiently. It is important to monitor the client's weight. A sudden weight gain means that the client is retaining fluid. This puts a strain on the heart and lungs. The nurse aide should weight the client every morning at the same time and record the weight. Notify the nurse of any sudden changes. Question 123. Which of the following is the safest way to confirm a resident's identity? Option A, check the ID bracelet or tag attached to the resident. Option B, look at the door number and compare it to your room list. Option C, ask the resident's roommate. Option D, call the resident by name and see if the person answers. The correct answer is option A. Check the ID bracelet or tag attached to the resident. Check the ID bracelet or tag attached to the resident. Accurate ID of a resident is always done by checking the resident's ID bracelet or tag. This is a universal standard of practice in every facility and healthcare setting. It ensures that the resident receives the correct treatment and care every time. Question 124. The opening of the colostomy to the outside of the body is called Option A, the stoma. Option B, the insertion site. Option C, the rectum. Option D, none of the above. The correct answer is option A, the stoma. The stoma. A stoma is an artificial opening in the body, created surgically. To create a colostomy, the surgeon brings the end of the colon through the abdomen and creates a mouth-like opening that will drain waste into a bag. A stoma can also be created for the bladder or the ileum, lowest part of the small intestine. Question 125. Signs and symptoms of shock may include Option A, increased blood pressure, bradycardia, and flushed skin. Option B, hyperventilation. Option C, absence of respiration and pulse. Option D, low blood pressure, tachycardia, and clammy, pale skin. The correct answer is option D, low blood pressure, tachycardia, and clammy, pale skin. Low blood pressure, tachycardia, and clammy, pale skin. Signs of shock include low blood pressure, rapid heart rate, weak pulse, and pale skin which can be damp or clammy. The client may be breathing rapidly. The client may also be confused or not alert. Shock is an emergent situation. Question 126. Normal urine color is Option A, colorless, Option B, brown, Option C, or red, Option D, yellow. The correct answer is Option D, yellow. Yellow. Normal urine color has a yellow that ranges from dark yellow to light straw color. Urine that is amber colored indicates dehydration. Brown urine can mean severe dehydration or liver disease. Red-tinted urine can occur after clients eat certain foods like beets or blueberries, or can be a sign of kidney disease, urinary tract infection, or prostate problems. Colorless urine may mean that the client is overhydrated. Question 127. To help ensure adequate circulation to prevent patient's skin breakdown, you should: Option A, perform active or passive range of motion exercises. Option B, give back massages. Option C, change the patient's position frequently. Option D, do all of the above. The correct answer is Option D, do all of the above. All of the above. One of the primary responsibilities of a nurse aide is to monitor the client's skin for any signs of breakdown. During baths, dressing, or position changes, inspect the skin. Reposition every 2 hours, protecting areas that rub together as well as the bony prominences. Massages of the back and buttocks can promote circulation. ROM are also helpful and report any changes to the nurse. Question 128. Before performing any procedure, a nurse aide must: Option A, identify the patient. Option B, explain the procedure. Option C, wash their hands. Option D, do all of the above. The correct answer is Option D, do all of the above. All of the above. Clinical standards require all healthcare professionals to identify the client by checking the ID band or tag before providing care. They should wash their hands both before and after client encounters. They should also explain what they are going to do and give the client an opportunity to ask questions before starting. Question 129. Which of the following statements about blindness are false? Option A, always identify yourself before touching a blind person. Option B, diabetes is a significant cause of blindness. Option C, most legally blind or visually impaired people have no sight at all. Option D, ask if a blind person needs help before you give assistance. The correct answer is Option C. Most legally blind or visually impaired people have no sight at all. Most legally blind or visually impaired people have no sight at all. People who are legally blind or visually impaired may still be able to see, but images can be quite blurry even when they're wearing glasses. Only about 10 to 15% of people who are diagnosed as blind see nothing at all. Question 130. Which of the following measurements that you obtain from Mrs. Shumway should be reported immediately to the charge nurse? Option A, a temperature of 99 F. Option B, a respiration 20. Option C, pulse 74. Option D, BP 190/114. The correct answer is Option D, BP 190/114. BP 190/114. Hypertension is defined as a blood pressure over 140/90. Severe hypertension is above 180/120. Even if the client has a history of high blood pressure, always immediately report a sudden increase to the nurse. Untreated hypertension can lead to heart disease and stroke. Question 131. On which side should the patient lie for an enema? Option A, whichever side is more comfortable. Option B, the side closer to the restroom. Option C, left. Option D, right. The correct answer is Option C, left. Left. The left Sims position is used for rectal examinations and administering enemas. The client lies on the left side, with the right knee and hip bent. It is also called the lateral recumbent or semi-prone side position. Question 132. A resident with an ileostomy evacuates feces through the: Option A, ileum. Option B, colon. Option C, jejunum. Option D, anus. The correct answer is Option A, ileum. Ileum. The ileum is the lowest part of the small intestine. An ileostomy is an opening in the abdomen that is created during surgery. The end of the ileum is placed outside the body and connected to a bag that collects the waste of the intestine. The ileostomy is usually on the lower right side of the body. Question 133. A nurse aide notices blood in the patient's foretubing. The aide should: Option A, stop the fore. Option B, notify the fore nurse. Option C, try to flush the tubing. Option D, do nothing, that's normal. The correct answer is option B, notify the fore nurse. Notify the fore nurse. When fore is running well, the tubing should be clear and the foresight clean and dry. If you notice blood in the tubing, notify the nurse. It is beyond the scope of practice for a nurse aide to do anything with fore. Question 134. Meal trays have arrived. Before serving each tray, the nurse aide should: Option A, check each armband, even on familiar patients. Option B, ask about dietary restrictions. Option C, ask patients if they are hungry. Option D, check the temperature of the food. The correct answer is option A, check each armband, even on familiar patients. Check each armband, even on familiar patients. Some clients have special diets, severe food allergies, or strict fluid restrictions. Before serving a meal tray, always check the client's ID band or tag and match it to the correct tray. Question 135. If the nursing care plan, you note that it is written, O2 per N/C at 3L, orthopnea POS, as needed. As a CNA, you know that this means which of the following? Option A, orient the new client at 3 o'clock to the orthopedic unit. Option B, the resident is to be ambulated every 3 hours. Option C, oral care must be performed every 3 hours. Option D, the resident is on oxygen with a nasal cannula on 3 liters. Assist to sit in Fowler's position. The correct answer is option D. The resident is on oxygen with a nasal cannula on 3 liters. Assist to sit in Fowler's position. Resident is on oxygen with a nasal cannula on 3 liters. Assist to sit in Fowler's position. Every facility has a list of approved abbreviations. The CNA should become familiar with these, for reading care plans and for preparing documentation. Question 136. Mrs. Shumway has an order for INO. You have picked up her breakfast and note that she drank half of a 6 ounces glass of juice, 4 ounces of milk, and 8 ounces of coffee. Therefore, you document: Option A, 240 ml. Option B, 450 ml. Option C, 685 ml. Option D, 920 ml. The correct answer is option B, 450 ml. 450 ml. Remember 1 ounce equals 30 ml. Add all the ounces intake and multiply by 30. Question 137. Which of the following are associated with smoking? Option A, the pneumonia. Option B, a vitamin C deficiency. Option C, heart attacks. Option D, all of the above. The correct answer is option D, all of the above. All of the above. The effects of smoking can cause many diseases and medical complications: lung cancer, COPD, emphysema, pneumonia, heart disease, heart attacks, and strokes. Vitamin C and B deficiency. Question 138. A patient who was given insulin in the morning is pale and sweaty and appears confused 2 hours later. It would be helpful to find out whether the patient: Option A, had visitors that day. Option B, ate too much sugar. Option C, had breakfast. Option D, has diabetes. The correct answer is option C, had breakfast. Had breakfast. Diabetic clients have a strict schedule regarding insulin injections and eating. Eating causes blood sugar to rise, and the insulin helps move it into the cells. Without food, the blood sugar drops quickly, causing a serious situation. Immediate treatment is necessary. Quickly check the blood sugar level and report it to the nurse. The client will need to eat 15 grams of glucose or a simple carb such as 1/2 cup of orange juice or a tablespoon of sugar. The nurse aide should be aware of which clients are diabetic so that meals are served shortly after the client receive insulin. Question 139. A patient complains that her hand hurts where the fore is running. The nurse assistant notices that the hand is puffy. The nurse assistant should: Option A, reassure the patient that needles always hurt. Option B, put ice on the hand. Option C, notify the medication nurse that the patient is complaining of pain. Option D. Notify the floor nurse that the infusion appears to have infiltrated. The correct answer is option D. Notify the floor nurse that the infusion appears to have infiltrated. Notify the floor nurse that the infusion appears to have infiltrated. Infiltrating occurs when the floor fluid leaks into the tissue because of a dislodged or misplaced floor catheter. The nurse assistant should monitor the floor site and report if it becomes swollen, cool to the touch, or painful. The skin near the floor site may look pale. Always be careful when moving or assisting a client within floor to avoid pulling the line. Question 140. When caring for a resident with an indwelling Foley catheter, you should: Option A. Tuck the tubing under the resident's leg to keep it off the floor. Option B. Append the tubing to the resident's gown. Option C. Withhold fluids if the bag is too full. Option D. Check the bag and tubing frequently for adequate urinary flow. The correct answer is option D. Check the bag and tubing frequently for adequate urinary flow. Check the bag and tubing frequently and for adequate urinary flow. Question 141. You are caring for Mr. Brown, who has a diagnosis of COPD. His SpO2 is 82%. He is currently receiving O2 via nasal cannula at 2 liters/min. What do you do? Option A. Turn the O2 to 4 liters/min. Option B. Switch the nasal cannula to a mask. Option C. Report it stat to the nurse. Option D. Ask Mr. Brown to take breaths more frequently. The correct answer is option C. Report it stat to the nurse. Report it stat to the nurse. The normal SpO2 range for a client with COPD is 88 to 92%. This is because oxygen reaches the lungs, but lung damage prevents oxygen from getting into the blood. For clients with COPD, giving oxygen is carefully regulated with limits according to how the oxygen is delivered. Immediately report a low saturation to the nurse. Do not make any changes on your own. Question 142. Mrs. Hernandez had a hip replacement and is admitted to the long-term care facility for rehabilitation. Her condition is considered: Option A. A chronic. Option B. A tonic. Option C. Acute. Option D. Obstetric. The correct answer is option C. Acute. Acute. An acute event is a new or sudden situation that is expected to resolve. Examples are a broken bone, head cold or flu, or an asthma attack. Question 143. To take a rectal temperature, a nurse aide should insert the thermometer and: Option A. Stay in the room until it is time to read the temp. Option B. Hold on to the thermometer until it can be removed. Option C. Take care of other patients, returning in 3 minutes. Option D. Go on a break. The correct answer is option B. Hold on to the thermometer until it can be removed. Hold on to the thermometer until it can be removed. A rectal reading is the most accurate but needs to be done correctly. After placing the client in Sims position, lubricate the thermometer and insert it about 1 to 2 inches into the rectum. Hold the thermometer in place for 2 minutes to prevent it from being pushed out or advancing into the rectum. Question 144. Drainage bags from urinary catheters should always: Option A. Be changed every shift. Option B. Be kept below the level of the bladder. Option C. Be fastened securely to the bed frame. Option D. Have their output measured each week. The correct answer is option B. Be kept below the level of the bladder. Be kept below the level of the bladder. Drainage bags from an indwelling Foley catheter should be kept below the level of the bladder to prevent urine from backflowing into the bladder. It also allows gravity to help drain the tubing. Question 145. The charge nurse has asked you to take Mrs. Shumway's vital signs. Before doing so, you must: Option A. Wash your hands. Option B. Gather all appropriate equipment. Option C. Identify the patient and introduce yourself. Option D. All the above. The correct answer is option D. All the above. All the above. Before providing care, the nurse aide must perform all the standard steps in preparation, including gathering everything you need, washing your hands, knocking and introducing yourself, identifying the client and explaining what you will be doing in their care. Question 146. A hospice specializes in the care of people who are: Option A. Chronically ill. Option B. Terminally ill. Option C. On Medicare. Option D. On Medicaid. The correct answer is option B. Terminally ill. Terminally ill. Hospice care is specialized care for clients who are terminally ill. The care includes the family and caregivers. It does not attempt to cure the client but to improve the quality of life for everyone involved. Question 147. When dry, hard stool fills the rectum and will not pass, it is called option A. Impaction. Option B. Edema. Option C. Incontinence. Option D. Atrophy. The correct answer is option A. Impaction. Impaction. Fecal impact ions commonly occur in people who suffer with chronic constipation. A fecal impaction is a massive dry, hard stool in the colon or rectum. The client is unable to pass without assistance. Stool may need to be removed manually by inserting a gloved finger into the rectum. Enemas and laxatives may also be tried. Question 148. Strokes are seen in the elderly. A stroke occurs when: option A. The heart fails. Option B. The brain is deprived of oxygen. Option C. The muscles die. Option D. The lungs fill with fluid. The correct answer is option B. The brain is deprived of oxygen. The brain is deprived of oxygen. A stroke occurs when the blood supply to the brain is cut off, so oxygen cannot reach the brain cells. Strokes are caused by blood clots in the arteries of the brain or a burst blood vessel in the brain. Question 149. Which of the following is a major reason for urinary incontinence in the elderly? Option A. The muscle that keeps the urine in the bladder weakens. Option B. They are too lazy to go to the bathroom. Option C. They can't tell when they need to urinate. Option D. Their circulatory system is failing. The correct answer is option A. The muscle that keeps the urine in the bladder weakens. The muscle that keeps urine in the bladder weakens. As part of the aging process, clients may experience incontinence due to weakness of the muscle that keeps the urine in until the client can go to the toilet. Another reason is that the bladder itself doesn't contract to expel urine. Bladder infections and prostate problems can also contribute. Alzheimer's or multiple sclerosis can also be causes. Question 150. Various factors will change pulse rate. Increased pulse rate can be caused by: option A. Coma. Option B. Depression. Option C. Sleep. Option D. Exercise. The correct answer is option D. Exercise. Exercise. The heart rate is lowest when the person is at rest or not engaging in physical activity. The heart rate increases when there is a need for more oxygen. Exercise always triggers a faster pulse. Other factors that raise heart rate could be pain, anxiety, stress, or too much thyroid medication. Question 151. Diabetes mellitus makes a resident more prone to develop: option A. Cancer. Option B. Chills. Option C. Fever. Option D. Infections. The correct answer is option D. Infections. Infections. Diabetics have high blood sugar levels, which can weaken the body's immune system. In diabetes, infections most commonly occur in the urinary tract and skin. Diabetics often have nerve damage. They can develop foot infections without realizing it. Question 152. When lifting a heavy object, which muscle groups should you use? Option A. Muscles of the back. Option B. Muscles of the hand. Option C. Muscles of the shoulder. Option D. Muscles of the legs. The correct answer is option D. Muscles of the legs. Muscles of the legs. When lifting a client or heavy object, use your legs to position yourself to support the load. Keep your back straight and locked, do not turn or twist. Bend your hips and knees to squat down. Keep the load close to your body and straighten your legs as you lift. Question 153. What can the nurse aide give a resident who has an order for NPO? Option A. Unlimited fluids. Option B. Small amounts of ice. Option C. Only clear liquids. Option D. No food or liquids. The correct answer is option D. No food or liquids. No food or liquids. NPO is a common medical term that means the client cannot eat or drink anything, including water or ice chips. A doctor may order NPO before surgery or certain lab work. If a client is ill or has a gastrointestinal condition, the doctor may write an order to be NPO until the cause is known. The nurse aide can provide mouth care for a client who is NPO. Question 154. Constipation and indigestion can result from Option A, slowed peristalsis. Option B, a slowed mental response. Option C, slowed brain waves. Option D, a slowed respiration. The correct answer is option A, slowed peristalsis. Slowed peristalsis. About 75% of elderly people have slowed peristalsis, muscular contractions that move food through the intestines, because there are fewer nerves to control the gut. As a result, food does not move in an even pattern, causing constipation and indigestion. Question 155. A nurse aide is going to take Mr. Heath's vital signs. What should the nurse aide do to reduce Mr. Heath's anxiety and get him to cooperate? Option A, explain the procedures to Mr. Heath. Option B, wear disposable gloves for all procedures. Option C, gather all needed equipment before beginning. Option D, wash her hands before and after. The correct answer is option A, explain the procedures to Mr. Heath. Explain the procedures. Before providing any care, the nurse aide must follow all the standard steps in preparation. Gather everything needed, wash hands before and after interactions, and always confirm client's ID. Explain the procedures to the client, even for routine tasks. Allow the client to ask questions before proceeding. Question 156. Elderly residents sometimes appear stooped over and seem to have lost height. This is due to Option A, decreased cardiac output. Option B, the residents' increased difficulty breathing. Option C, the deterioration of muscle tissue. Option D, osteoporosis in the spinal column. The correct answer is option D, osteoporosis in the spinal column. Osteoporosis in the spinal column. Osteoporosis in the spinal column can lead to a gradual loss of height and stooped posture. The loss of calcium in the vertebrae of the spine can cause fractures and back pain, although most are tiny and painless. Can occur in both older men and women. Question 157. The nurse aide notices on the flow sheet that a resident has not had a bowel movement for 5 days. The nurse aide should Option A, report this to the charge nurse. Option B, wait to see if she uses the bathroom tomorrow. Option C, ask the resident's roommate if she saw the resident use the bathroom. Option D, ask the other nurse aides if the resident had a bowel movement that wasn't recorded. The correct answer is option A, report this to the charge nurse. Report this to the charge nurse. Although each person has a unique pattern of bowel movements, the normal number is 3 to 14 times a week. If the client has had a sudden change in bowel habits or is experiencing bloating, pain, or nausea, the cause should be investigated. Adding fiber and fluids to the diet can help prevent constipation. Question 158. Which of the following is true regarding the use of side rails on a bed? Option A, side rails on one side of a bed should be raised at all times. Option B, side rails should be raised at night. Option C, side rails should be raised on both sides when making an occupied bed. Option D, side rails should not be raised unless stated in the care plan. The correct answer is option D. Side rails should not be raised unless stated in the care plan. Side rails should not be raised unless stated in the care plan. Bed rails can be a safety risk for some clients, who might be injured while trying to get out of bed. Clients can also become trapped or strangled in bed rails. Using bed rails without permission can be seen as an attempt to restrain the client. Always follow the care plan regarding use of the bed rails. Question 159. The plan that starts on the resident's admission and assists when the resident goes home is called Option A, the nurse aide flow record. Option B, the nursing care plan. Option C, the discharge plan. Option D, the treatment plan. The correct answer is option C, the discharge plan. The discharge plan. A good discharge plan allows for continuity of the care that begins on admission. It anticipates possible issues or barriers that the client or the client's family may encounter, and services that will be needed after discharge. All team members can contribute to the plan, based on their interactions with the client. Question 160. The loss of the ability to express oneself is known as Option A, a verbal communication. Option B, aphasia. Option C, speech therapy. Option D. Empathy. The correct answer is option B. Aphasia. Aphasia. When a client has suffered a stroke or some other head injury, the speech center of the brain can be damaged, resulting in aphasia. Chief signs of aphasia include difficulty finding appropriate words when speaking, trouble understanding speech, and difficulty with reading and writing. Question 161. There are two kinds of restraints. Option A, chemical and physical. Option B, masks and goggles. Option C, chemical and medication. Option D, belts and wristbands. The correct answer is option A, chemical and physical. Physical and chemical. There are two categories of restraints. Physical restraints are devices that are designed to restrict movement like vests, belts, hand mitts, or bed rails. Chemical are medications to control behavior such as yelling or combative behavior. All restraints require a physician's order. Question 162. Wasting or a decrease in the size of a muscle is called option A, edema. Option B, decubitus. Option C, atrophy. Option D, impaction. The correct answer is option C, atrophy. Atrophy. Muscle atrophy is a loss of muscle mass. The main cause is lack of physical activity, which may be due to injury or disease. After injury, the muscles are often immobile or painful to move. Diseases which lead to atrophy include multiple sclerosis, anorexia, and AIDS. Question 163. A resident is NPO for tests. The nurse aide should: option A, allow the resident to eat ice chips. Option B, encourage fluids for hydration. Option C, allow the resident to drink water only. Option D, remove the water pitcher and glass from the room. The correct answer is option D, remove the water pitcher and glass from the room. Remove the water pitcher and glass from the room. NPO is a common medical term that means the client cannot eat or drink anything, including water or ice chips. A doctor may order NPO before surgery or certain lab work. The nurse aide can provide mouth care for an NPO patient. Question 164. When lifting, the nurse aide should have their feet separated in the standing position to: option A, provide a wide base of support. Option B, to prevent straining the knees. Option C, or relieve the pressure on the toes. Option D, distribute body weight evenly. The correct answer is option A, provide a wide base of support. Provide a wide base of support. When feet are placed shoulder width apart, a comfortable and wide base of support is established. With a wide base, you are less likely to lose your balance. Question 165. Who supervises the work of a nurse aide? Option A, a nurse. Option B, the office manager. Option C, a social worker. Option D, the resident's family. The correct answer is option A, a nurse. A nurse. The work of a nurse aide is overseen by a RN or a LPN/LVN. The scope of practice of the RN/LPN includes having responsibility for staff who provide daily, hands-on care for clients. Open communication makes for excellent care. Question 166. A diabetic resident asks the nurse aide to cut her toenails. The nurse aide should: option A, do it because it is part of the job. Option B, tell the resident okay, but they will have to soak their feet first. Option C, tell the resident that the nurse aide cannot do it but will report it to the charge nurse. Option D, ask another nurse aide to help. The correct answer is option C. Tell the resident that the nurse aide cannot do it but will report it to the charge nurse. Tell the resident that the CNA cannot do it but will report it to the nurse. Diabetics often have neuropathy and may be unable to tell if their feet are injured. Even trimming toenails can cause an injury. Diabetics need expert care from a podiatrist or a qualified foot care professional. You can be held liable if the client develops an infection after you cut her toenails. Question 167. A hepatitis B vaccination protects the person receiving it against a disease that affects: option A, the skin. Option B, the kidneys. Option C, the liver. Option D, the heart. The correct answer is option C, the liver. The liver. Hep B is a serious, contagious infection caused by the Hep B virus, HBV. Most commonly spread by exposure to body fluids, it can cause both acute and chronic disease. Many agencies and facilities require employees to receive the HBV series. Question 168. All of the following statements about type 2 diabetes are true except Option A. Type 2 diabetes is very rare in adults. Option B. It is associated with being overweight or obese. Option C. Type 2 diabetes may require medications or insulin. Option D. It can be controlled with diet and exercise. The correct answer is option A. Type 2 diabetes is very rare in adults. Type 2 diabetes is very rare in adults. More than 34 million Americans have type 2 diabetes, usually occurring in adults over 45 who are obese and inactive. It is a chronic disease that requires ongoing medical management. There is no cure, but it can be controlled with lifestyle changes like diet and exercise. Medications or insulin can be helpful in managing blood sugar levels. Question 169. A Foley catheter is used. Option A. As a rectal tube. Option B. To suction stomach contents. Option C. To drain urine from the bladder. Option D. For gastric feeding. The correct answer is option C. To drain urine from the bladder. To drain urine from the bladder. A Foley catheter is a sterile tube that is placed into the bladder to drain urine. It is held in place by a balloon that is inflated after being inserted. You should check that the tubing is open so that the urine can flow from the bladder. After each position change or whenever the client returns to the bed or chair after being up, ensure that the tubing is not kinked or closed and the bag is lower than the bladder to prevent backflow. Question 170. What is the purpose of the chain of command in a long-term care facility? Option A. To keep communication about a problem flowing smoothly. Option B. To be sure that residents follow the rules. Option C. To prevent residents from going behind the nurse's station. Option D. To provide more jobs in nursing. The correct answer is option A. To keep communication about a problem flowing smoothly. To keep communication about a problem flowing smoothly. Every staff member has a role in providing excellent client care. With good communication, each person can work within their scope of practice and allow others with different authority to handle the appropriate tasks. Question 171. To count respirations, one respiration includes Option A. 1 inhalation. Option B. 1 exhalation. Option C. 1 inhalation and 1 exhalation. Option D. 1 inhalation and 2 exhalations. The correct answer is option C. 1 inhalation and 1 exhalation. 1 inhalation and 1 exhalation. The normal respiratory rate for adults is 12 to 18 breaths per minute. To get an accurate respiratory rate, choose a time when the client is resting. Observe the client for 1 minute while counting. Each rise and fall of the chest represents 1 respiration. While counting, note if the client is having trouble breathing or taking full inhalations. If so, notify the nurse. Question 172. The nurse aide knows to wear which of the following when performing care for clients? Option A. Shoes with non-skid soles. Option B. Name badge with job title. Option C. Clean uniform or scrubs. Option D. All of the above. The correct answer is option D. All of the above. All of the above. The nurse aide is considered a healthcare professional and should dress accordingly. Each facility has a dress code policy regarding the type of uniform to wear. Shoes must be closed-toe and non-skid soles. Question 173. Why should heat not be applied to a diabetic resident's feet? Option A. Their feet might be dirty. Option B. It makes diabetics' feet wrinkle. Option C. Diabetics have decreased sensitivity to heat. Option D. The feet have more oil glands. The correct answer is option C. Diabetics have decreased sensitivity to heat. Diabetics have decreased sensitivity to heat. Diabetics often have neuropathy and may be unable to detect if their feet are injured and detect temperatures. Diabetics should always wear socks and shoes to prevent cuts or injuries to their feet. Question 174. Many elderly residents lose their appetite because of Option A. Social isolation. Option B. Decrease in number of taste buds. Option C. Depression. Option D. Any of the above. The correct answer is option D, any of the above. Any of the above. As people age, loss of appetite can be normal, but there are also specific reasons that the ability to enjoy food declines. All listed can be causes. Other causes include dental problems and side effects of medications. Question 175. The best way for a nurse aide to gather information about the safety and well-being of a resident is: option A, observation; option B, to listen to the nurses talk in the med room; option C, to listen to other nurse aides during the break; option D, flow sheets. The correct answer is option A, observation. Observation. As the primary staff member providing hands-on care for a resident, the nurse aide is able to observe the resident's current condition accurately. Flow sheets provide information about the resident over time, but the nurse aide is able to assess the situation in real time. Question 176. For most residents, the range of normal respiration is: option A, a 28 to 30 inspirations/minute; option B, a 12 to 20 inspirations/minute; option C, 8 to 16 inspirations/minute; option D, a 20 to 28 inspirations/minute. The correct answer is option B, 12 to 20 inspirations/minute. 12 to 20 inspirations/minute. The normal breath rate for adults is 12 to 20 times/minute. Question 177. Which of the following is a proper way to correct an error in charting? Option A, use correction fluid; option B, scribble it out with several lines; option C, draw a single line through it; option D, erase it completely. The correct answer is option C, draw a single line through it. Draw a single line through it. There are strict guidelines on how to correct a charting error. Never erase or cover the error. Draw a single line through so that the entry is still visible. Add the date and your initials. Continue with the correct entry. There can be serious consequences for you and your facility if proper protocols are not followed. Question 178. Headaches, nausea, and pain are considered: option A, observations; option B, symptoms; option C, assessment; option D, charting. The correct answer is option B, symptoms. Symptoms. Symptoms are the client's experience of how they feel pain, things only the client can perceive and report. They may contribute to signs that are observable, but the symptoms begin with the client. Question 179. Signs of poor circulation include: option A, hot flashes; option B, paleness, cold skin, and edema; option C, perspiration and red skin; option D, warm, dry, pink skin. The correct answer is option B, paleness, cold skin, and edema. Paleness, cold skin, and edema. Poor circulation is the result of another medical condition. Peripheral artery disease, PAD, is a narrowing of the blood vessels in the arms, legs, head or stomach, resulting in impaired blood circulation. Without a good blood supply, the skin becomes cool and pale. Edema develops when extra fluid cannot be returned to the heart. Other symptoms include numbness, tingling, pain, or cramps. Other causes of poor circulation are diabetes, obesity, and varicose veins. Question 180. If the resident is smoking and the nurse aide needs to take an oral temperature, what should the nurse aide do? Option A, tell the next shift to take the temp. Option B, brush the resident's teeth first. Option C, take a rectal temp. Option D, wait 15 minutes to take the temp. The correct answer is option D, wait 15 minutes to take the temp. Wait 15 minutes to take the temp. Before taking an oral temp, determine if the client has smoked or had anything hot/cold to drink in the last 15 minutes. If so, wait a full 15 minutes before taking the temp to obtain an accurate measurement. Question 181. A nurse aide is assigned to a stroke patient with a diagnosis of aphasia. Option A, the nurse aide knows that the resident cannot walk. Option B, the resident cannot swallow. Option C, the resident cannot talk. Option D, none of the above are true. The correct answer is option C, the resident cannot talk. The resident cannot talk. When a client has suffered a stroke or other head injury, the speech center of the brain can be damaged, resulting in aphasia. Chief signs are difficulty finding appropriate words when speaking, trouble understanding speech and difficulty with reading and writing. Question 182. A sitting or semi-sitting position with the head of the bed elevated is called Option A, Fowler's, Option B, prone, Option C, supine, Option D, lateral. The correct answer is Option A, Fowler's. Fowler's. Fowler's position is the standard way to position a client to improve oxygenation. There are several types of Fowler's. High Fowler's, 90-degree angle to allow the chest to expand. Semi-Fowler's 45 to 60-degree angle for drainage and comfort. Question 183. The exchange of oxygen and carbon dioxide takes place. Option A, around the kidneys. Option B, in the lungs. Option C, in the intestines. Option D, in the heart. The correct answer is Option B, in the lungs. In the lungs. The lungs are the main organs of the respiratory system. They take in oxygen during inhalation and release carbon during exhalation. These gases are exchanged in the tiny air sacs of the lungs, called alveoli. Question 184. A bedsore or decubitus ulcer is caused by Option A, burns. Option B, fatigue. Option C, inadequate turning. Option D, abrasions. The correct answer is Option C, inadequate turning. Inadequate turning. One of the primary responsibilities of the nurse aide is to monitor the client's skin for any signs of breakdown that could lead to bedsores. During baths, dressing, or position changes, inspect the skin for redness, pallor, warmth, or bruising. Reposition at least every 2 hours, protecting areas that rub together. Massages to the back and buttocks can promote circulation. ROM exercises are also helpful. Always report any sign of skin breakdown to the nurse. Question 185. The thinning of the fatty layer under the skin could cause a resident to Option A, lose his or her appetite. Option B, have difficulty walking. Option C, develop pressure sores. Option D, have slowed mental responses. The correct answer is Option C, develop pressure sores. Develop pressure sores. The outer layer of skin becomes thin and appears pale and clear. Blood vessels become fragile, leading to bruising and bleeding under the skin. The fat layer also thins, so there is less padding, increasing the risk of injury or pressure sores. Rubbing or pulling on the skin can produce skin tears. Question 186. The goal of the healthcare team is to Option A, obtain reimbursement. Option B, provide quality care. Option C, assign tasks and responsibilities. Option D, provide case management. The correct answer is Option B, provide quality care. Provide quality care. Healthcare teams are based on the idea that no one has all the knowledge to do everything for a patient. By having each specialty contribute, the patient gets the best possible care. Question 187. Which is incorrect when you're recording on a patient's chart? Option A, your handwriting must be legible. Option B, record only what you observed and did yourself. Option C, record in a logical manner. Option D, use a pencil in case you make a mistake. The correct answer is Option D, use a pencil in case you make a mistake. Use a pencil in case you make a mistake. All documentation must be done in permanent ink. If you make a mistake, follow your facility's policy on correction. Usually a single line through the error, along with the date, time, and your initials. Question 188. Who is responsible for the entire nursing staff and the activities involved in providing safe care? Option A, a registered nurse. Option B, the supervisor. Option C, the case manager. Option D, the director of nursing. The correct answer is Option D, the director of nursing. The director of nursing. The DON is a registered nurse who oversees all patient care at a facility. They supervise all nursing staff, manage budgets, and handles patient and family issues that staff RNs can't resolve. Question 189. A healthcare agency or program for patients who are dying is Option A, a preferred provider organization. Option B, managed care. Option C, hospice. Option D, case management. The correct answer is Option C, hospice. Hospice. Hospice is a special type of care for patients with life-limiting conditions, their families, and their caregivers. The goal is to maintain the patient's dignity and quality of life, while supporting each person. Question 190. The RN assigns you a task that is in your job description. Which of the following statements is false? Option A. The RN should give you clear directions before you perform the task. Option B. The RN can delegate the task to you if it's suitable for the patient. Option C. The RN should delegate every non-RN task to you. Option D. The RN should check that you have the necessary education and training. The correct answer is option C. The RN should delegate every non-RN task to you. The RN should delegate every non-RN task to you. Although the RN can assign or delegate tasks that are in your job description, they should ensure you know how to do the task and that it's beneficial to the patient. Some non-RN tasks may be outside of the scope of your CNA practice. If so, inform the RN.